as suicide survivors that have come together, we have realized in retrospect that we can't wait for a crisis. We can't wait for our kids to sort of jump into the river, right? That work we're doing in crisis management, suicide prevention, don't get me wrong, super, super important. We have to jump in and save them, obviously. However, what makes much more sense to us as survivors is actually to do what's called going upstream. So why would we do this? It makes a lot more sense to actually prevent our kids from jumping in the first place. So, kind of in a nutshell, what we're trying to do at Foundation for Life is we're trying to go all the way upstream and do programs which get into sort of the earliest developmental windows for our kids. And what we do is we hardwire resilience, making life the only option.
I just had an analogy as you're talking. It's like you have a child that you don't want to drown. So instead of just hiring somebody to watch the pool and when they're drowning, they'll save them, you teach them to swim
Yes.
as early
Yes.
as you can.
Yes, exactly.
As early as you can, you teach them to swim.
Yes. So when we're building this fence of hope and kind of cultivating the will to live in children, we are doing it by building 5 program pillars, which we can talk about if you like. Which again, it's about hardwiring resilience and hardwiring hope into our children. And in my own personal situation, when I think about, what led me to take my own life and what would have made the difference, I really feel if these 5 program pillars had been in place, I perhaps wouldn't have attempted 3 times.
I want to get a lot later on into actually tangible solutions, what we do, but I actually wanted to talk about your own story of what you want to share. You've said you have done counseling, you've worked with youth, you've done dialectical behavior training sessions, which is something you can tell me about that later in terms of suicide prevention. What's your story that you want to share that's led you to be you and I connecting over this suicide prevention upstream organization that you are launching?
Well, I mean, I've been doing mental health advocacy work for a couple different decades. It all started for me. As you mentioned at the outset, I like to call it anyway, I thrive with a bipolar diagnosis. I haven't always been thriving, let me just put it that way. The world is a difficult place for people with bipolar. We're often misunderstood and certainly stigmatized. And for me, it started actually when I was at Harvard. I was really, really struggling. My mother actually is also a suicide survivor. I was struggling with that. I was struggling with coming out of the closet. And I really kind of lost my way. I found it within myself to reach out to the mental health clinic at Harvard and set up an appointment. I went, I poured out my soul, and had a good sort of what I thought was a good session. I went back to my apartment in Somerville and I stepped into the apartment. About 10 minutes later, I got a ring, and the woman I had poured my soul out to was on the other end of the phone, and she says, "Kerry, I'm sorry, but I can't help you." And
Oh gosh.
at that moment, that was sort of a clinical failure, understatement. I just felt like, oh my goodness, Suzanne, I'm actually beyond help. I spiraled down after that and just didn't have the support I needed, and I felt like I didn't belong, and the world would just be better off without me. And that led to my first attempt. Thankfully, I'm still here. And then some other things happened in my life where I just couldn't get myself sorted. I didn't have the coping skills, the emotional regulation, distress tolerance, all the things we're taught in DBT to really to stay. It's one of the things we talk about, foundation for life is to stay. One more day the world needs you. I just couldn't get it together. So I've been through a lot, but I've managed to turn my kind of pain into purpose, and to now build what we call it also in DBT, kind of a life worth living. And I want to make sure nobody goes through what I did. And part of Foundation for Life is making sure our children never go out on the edge like that, and they never ever contemplate suicide, the word suicide is just a completely foreign concept to kids.
Mm.